Hello everyone, welcome to PHTV Channel 4 in Palos Heights. I'm Pamela Payne and I'm here with our next episode of In the Know. Today our guest is Dr. Adriana Zabrosky, and she's the founder of Zabrosky Chiropractic and Wellness Center. So we'd like to welcome you to our show.
Thank you, Pamela.
So in your opinion, what is the number one issue that strongly impacts our health?
That's a great question, Pamela. I think that the main impact on our health is stress. You can look at it in various ways. You said that people will work out for 5 weeks, they have real good intentions, and what is the big excuse? It's stress. I'm too stressful, I got too many things going on, I don't have time for this. But also stress will affect our health, and we all know that. I have patients every day asking me, could this be due to stress, whatever their condition is? The answer always is yes. But how is it that stress affects our health? What is stress exactly doing? It affects us in several ways. One, it affects our organs in various ways, and that's a lot of detail to go into. Right. But stress affects our muscles, and when our muscles get affected and tightened, that starts a whole can of worms of problems that occur within our body.
So tell us a little bit about you're in chiropractic services. How does your spine affect your total health?
That's another good question. It all ties in with stress. As I said, as our muscles tighten, those muscles are attached to our bones. And as our bones are pulled out of alignment, what happens is pressure's put on the nerve. Just like in your instance, you talked about the bulging disc. A disc bulges from stress, from muscle tension, pulling out a bone. If I may, I'll just demonstrate it on my friend who I brought here today. The basic principle behind how our spine affects our lives really is everything in our life is controlled through our brain. All the information we need, good, bad, motion, sensation, and that information to get to the rest of our body has to travel down through the spinal cord. And now, how does it get to the pancreas? How does it get to the kidney? How does it get to certain muscles? It does so by exiting out these nerve roots. And these nerve roots then branch out, as will be demonstrated, to all our organs, muscles, and tissues. Well, again, due to stresses, due to strains in life, bones will move out of alignment. And when they do, they begin to put pressure on these nerves.
Okay.
When that happens, chiropractors call that a subluxation. And when that happens now, we're not getting that proper brain input coming from the brain through the spinal cord out the nerve root to our various organs and muscles. And that's where disease begins.
The mind sends the message through the spinal cord out the nerve endings to the rest of the body.
Right, and it tells your body to regenerate. You know, when you cut your hand, how does that hand heal?
Right.
You heal it. We heal ourselves. So, but in order for that to happen, the brain is needing to communicate down through the spinal cord. Now, if you've got a bone putting pressure on a nerve, how quickly is that person going to heal? It's not going to heal as quickly as somebody with a healthy nervous system.
That's true, because then that would stop the message flow.
Exactly.
So what are some strategies that that people can establish or maintain for a healthy lifestyle?
Well, there's 5 facets of health, and in order to achieve optimum health, I recommend people follow all 5 facets to their best ability on a daily basis. The first being proper nutrition. You know, you want to ask yourself, did I drink enough water today? How much sugar did I have today? Did I have some fruits and vegetables? We should be getting 4 to 6 servings of fruits and vegetables on a daily basis. We also have to look at proper exercise. When I went to park at the store, did I wait for the handicap parking or next to it, or did I park far away and walk? And I know it's cold, so then you walk a little faster, you get a little more exercise. You know,
That's
you see
right.
Escalator, elevator, stairs, always take the stairs. So little ways to get exercise. The third facet of health would be to maintain a positive mental attitude. You know, listening to tapes on wellness and motivation, meditating. So there's various ways. Avoiding negativity. You know, if there's negative people in your life, avoid the negativity.
Right.
Little things you can do. Then the fourth facet, which to me is a very important one, is proper rest. Because many of us don't get the proper rest we need.
Right.
And there's different factors to look in on that. One being, how do we rest? How do you sleep? Do you sleep on your stomach? Very bad way to sleep.
That's me.
We'll have to go over that. Side sleeping, back sleeping are good ways, but there are specific ways to sleep.
Right.
And not just resting when we sleep, but how about when you're watching television?
Right.
You know, are you laying on that couch and your head's hitting the back of the armrest? Very bad position to be in. And you have to think about the fact that people don't do that for just 2 or 3 minutes. They might be doing that 2 to 3 hours every night.
That's true.
And that's damaging the nerves coming out of the neck, for instance.
Right.
And then, of course, to me, of utmost importance is maintaining a healthy nervous system. Because
Right.
without that healthy nervous system, you're not going to get the proper regenerative properties going to your body. You're not going to get resistance working for you, and all the function that our brain allows our body. And
Right.
another danger in that is you felt it, but 80% of the time people don't feel when a bone is
Really?
out of alignment. So you may not be feeling pain in your neck or in your low back, but it doesn't mean that you're not getting the proper nerve supply, because 80% of the nerves that exit, they're functional. They're going to an area to cause something to move, to constrict, to dilate. So unless the bone is on the sensory aspect, as it was in your case, a person may not even feel when a bone is out of alignment.
That may be true. That's true. And I think that, you know, the happier you are, the healthier you'll become.
Absolutely. 2 things that I recommend people to do in the morning: think of 5 things that you're grateful for every day, and make them different. Don't make it, oh, I'm grateful for my family. I mean, of course we're grateful for our families,
Right.
but think of things that maybe you wouldn't typically think of. And number 2, you know, perform some random act of kindness every single day.
That is a gift.
A little thing. Take somebody's shopping cart as they're bringing it back, although now you're taking exercise away from them. But, you know, there's little things we can do on a daily basis and to keep positive. And just think, if everybody did that, it'd be a nicer world.
It would be, and we'd feel better. You know? So let's talk a little bit about, how did you get in this field? You know, you do like, I understand that you do like health talks to the community and anyone for free, and organizations and things like that. How did you
Yes.
kind of get into this area?
Well, I was working in New York, totally unrelated to the field of healthcare, and a fellow who was at the office where I worked at would go to the chiropractor, and he asked if I would drop him off on a few occasions. And he seemed to be like in really good shape. He didn't have any complaints, and I said, why do you go to the chiropractor? And he said, well, he saved my life. I said, what are you talking about? Don't they like bend your bones or do something to bones, and aren't they just for older people? And he said, no. He said he had severe asthma, to the point he had to be hospitalized 6 to 7 times a year. And it wasn't until he went to a chiropractor that his asthma symptoms dissipated. And I had no clue how that could be. I said, well, I thought they treat your back. What does that have to do with asthma?
Right.
And he said, go to this guy's talk. He gives a talk. And this was out in Center Moriches, New York. And Joe Murphy, he was probably about 80 when I first met him, the chiropractor, gave a health talk that changed my life.
Wow.
Talked about the 5 facets of health, talked about how the brain supplies all the information we need to our body to get well, and I was just amazed with what I learned in that 1 hour. Anyway, I didn't have any symptoms. I had no issues, but I thought, well, I don't know, 80% of the time you don't feel it, so I thought, I'm going to get my spine checked. So he checked my spine, and he did find subluxations in my spine, bones that are out of alignment. And I got an adjustment, and I didn't think I felt bad. But when I got adjusted, I could not believe how fantastic I felt.
Wow.
You know, I had this overall sense of well-being. My vision felt clear. I felt more alert. Also, my posture. I mean, this was my posture. All of a sudden, I got up off the table, and I'm standing erect. I'm feeling good.
Right.
And I just was amazed with it. I couldn't stop talking about chiropractic to anybody.
Wow.
So finally my friends were like, enough with the chiropractic. They said, why don't you just go become one? And I said, I think I will. And I did, and it's the best decision I've ever done.
Wow.
Love it. Want everybody to know about it.
Right.
When I first learned about it, I thought, why don't we all know this?
Right.
We should all know this, and we should all get our spines maintained and aligned. And you know, this was 30 years ago, and I've been going once a month. I'm still a patient. I go once a month. I've been doing it for 30 years. Haven't taken an antibiotic in 30 years.
Wow.
I don't have joint pain. I don't have muscle pain. I don't have high blood pressure. I'm not on any medications, and I attribute it to the fact that I've kept my nervous system working for me.
Right, right.
And I want that for everybody.
That's right. So we want to keep you in the know about this.
Yeah.
That's excellent. So, you know, you talked about these health talks. I know that you do them. Do you have any upcoming events where people can find out more information or things like that?
I give a health talk at my office. It's in Woodridge, Illinois.
And we'll have that information on the bottom.
I give it every Wednesday at 7 o'clock. I also do them on different evenings if a lot of people have church choir on Wednesdays, so we can move it to a Tuesday. But I also have made it a point of giving the talk to anybody who asks for it. So I go to different communities, I speak at churches, at companies. I've spoken probably I've done about 100 health talks now to various organizations and companies.
Wonderful.
And I love doing it, love having people learning, you know, about it just like I did 30 years ago.
Well, excellent. Well, we'll have Dr. Zabrosky's information at the bottom of our screen. So if you're interested in, you know, in having her come or coming to her for her health talk, we'll definitely have that information at the bottom of our screen. Do you have anything that you would like to, you know, leave the audience with?
Well, I just want everybody to do the best they can in 2013, one day at a time. Follow the 5 facets of health. Again, proper diet, proper exercise, proper rest, positive mental attitude, and make sure you have a healthy nervous system.
Well, we're so glad to have you. Thank you so much.
It's great to be here.